Clear and Brilliant is manufactured by Salter Medical, who own Fraxel. It got FDA approval in 2011 and its official launch was April 2012. The device incorporates some of Fraxel's technology. It has intelligent optical tracking and it has two wavelengths. One is 1440 nanometers for deeper penetration and a 1927 diode laser for superficial skin texture. So the tips are disposable, single use. The machine operates on a card system, so each card will give you 12 treatments. Each wavelength will actually have a card and 12 tips associated with it. Although this device comes from some of the Fraxel technology, it is not a Fraxel device. However, it is a very powerful device and has its own unique ability. So the 1440 nanometer wavelength is actually going into the dermis around 300 to 400 microns, and it will stimulate collagen. The ideal patient for this is somebody who's a little bit younger. The other wavelength, the 1927, is actually working superficially, so about 170 microns into the skin, and is really working on the superficial plane for fine lines and some of the pigmentation. Clear and Brilliant can be used by a doctor or a nurse, but also it could be delegated to a lesser qualified person. In some clinics, a therapist will actually use this device under the supervision of a doctor. So the Clear and Brilliant is actually quite unique. Although it actually improves the tone, texture and luminosity of the skin with both wavelengths, each wavelength brings something new to the market. The 1927 nanometer wavelength actually has the ability to create more permeability with the skin. And so when you use this wavelength, you're creating microscopic spheres in the skin that actually allow you to put product on and allow that product to have greater absorption. Clinical studies have shown that 17 times greater absorption of products can be achieved. With its 1440 wavelength, it actually brings pore tightening, and this is actually something that's been recognised by the FDA and given a stamp of approval as gold standard in pore refining. So if you have a Clear and Brilliant in your clinic, the benefits that you will see is that you can delegate this treatment to people who aren't as qualified as you, freeing up your time. Patients love it, and so they'll come back not just for one but a course of treatments, and because there's very little downtime, they'll be able to go on to have other treatments as well. The device is lightweight and portable, so you can move the device from one room to another or even one clinic to another. Patients can see benefits after one treatment, although obviously they'll like what they see and they'll want to have more. We would normally say that they need a course of 4 to 6 treatments. They can see a change, particularly with the pore refining treatment, even after one. Clear and Brilliant can be incorporated with other treatments. And so, for example, if you had a thermage, and of course you have to wait for about 6 months to see the results of a thermage, you could actually have a Clear and Brilliant on the day, immediately after the thermage. So, Kerry, you've come here today because you're interested in Clear and Brilliant, is that right?
Yes. Yeah.
What were you actually looking for?
Well, mainly 2 things really. I get pores across my T-zone, and I also get them on my cheeks, near to my nose. The other thing is that I get spots, but that doesn't really bother me. They don't last very long. I get brown marks after the spots, and that lasts quite a while, and end up having to cover it with makeup.
Okay, so pore refining and also just improvement of the general kind of colour of the skin, so making it all look more even. Yeah. Is that what you're looking for? Okay, that's great. So then Clear and Brilliant would be something that would be appropriate for you. I'm going to give you this anyway, just to take away with you. And I understand that you have somebody that's already had it, you're a friend of yours? Yeah. Okay, and so did you see them during the treatment recovery?
Yeah, I saw them afterwards.
Okay. So you haven't been put off by that?
No.
All right. So let me just explain. I've gone through your history, so there's nothing medical in here that would be a concern to me to offer you the treatment. And what you're looking for is exactly what the Clear and Brilliant can give you. There's 2 wavelengths in the Clear and Brilliant device. The first one is the Clear and Brilliant, which is the 1440, the original one. Second wavelength is 1927, which although is a nice treatment, it's not appropriate for refining the pores. It's going to actually allow you to absorb more product. And so today we're going to be offering you the 1440 nanometer, which actually is going to put heat into the dermis, the living part of the skin, and by doing that it stimulates collagen, and then you'll get a tightening of the pore and a reduction of the amount of oil that's sitting in there, so the pores will look finer. Now, it's not just a single treatment, although after treatment after one treatment you can see some changes. You need to have about 4 treatments, and they're given at 2 weekly intervals, something like that, really, depending on how quickly you actually recover.
Okay.
We'll also use local anaesthetic during the treatment, just a cream to numb the area a little bit, because although it's not terribly uncomfortable, there's still going to be some discomfort associated with it, so we want to reduce that for you. And there'll also be a cold air machine that you can use if you like to actually help even further. When I'm doing the treatment, I'm going to mark the skin, and I'll be going over the area in a very methodical way so that we actually cover all the areas, not leaving any gaps. Normally I would do 4 passes all over the face, and then we'll do an additional 4 passes in the areas that you've actually indicated are your pore kind of zones, because that will actually help to have a more of an impact on it. Local anaesthetic will be left on for about 20 minutes, so the whole thing is just going to take over an hour. You've had local anaesthetic before, and so there hasn't been any issues with that. That's great. And then once you've finished the treatment, we'll put some nice soothing creams on, and of course a sunblock. That's really important. And you've got creams from us already, so you're going to use those after. The sunblock's one of the most important things. When you leave here, your skin is going to be slightly red. So what are you like when you go to the gym and work out? Do you get quite red?
Yeah, I do go quite red.
So expect that, and expect that to subside by tomorrow. So if we set that expectation, then if you're still a bit pink by tonight, then you're not going to be too worried about it. And we'll see you in about a week's time just to see how things are. We'll take some photos of you. Okay, how does that sound?
Yeah, perfect.
Good. So Kerry, just let me show you some pictures of people that have actually had one treatment, so you can actually get an idea of what it's going to like after one. Of course, you do need to have more than one treatment, as I said, and so you get that accumulative effect. And so this lady here, this is the before, this is the after. The blue represents the pores, and so you can see after one treatment there's a significant reduction in numbers, but also there's a reduction in the size of the pore. And so this girl here, quite an oily area, and there's some redness there. So we've reduced the pores and in size and number again, and also some of the redness has actually subsided as well. So it indicates that there's a healthier skin. And then this lady here, a little bit older, but she actually noticed the smoothness of her skin and that the pores were much finer, particularly around the chin area. This lady, lots of pores. She also had some marks on the side of her face, which is similar to what you've said you have. And so we can see them here when we look at the red part of the viscera. And so here are the marks shown by blue, and then afterwards, after one treatment, you can see they're greatly reduced. This girl's similar to you, where she had marks on her skin after spots, and those marks showed up when we looked at the vascular aspect, and you can actually see that a lot of them have gone. In fact, it's a really good clearance just after one treatment. So is there anything else that I can show you?
No, that's great, thanks.
Okay. We'll take a picture of you, and then we'll take you through and put on the local anaesthetic. So we're going to take a picture of you using the Visia, and this is going to give us a good measurement of what your skin is like today, and then when you come back we can actually repeat those photos so that we can actually start to see the reduction of your pores as I suggested to you. And at the end of your course of treatment we'll be able to measure what you were like in the beginning, because you do forget. So what I need you to do is go into the booth, and I'm going to get you to put your chin here. If you look back into the back of the booth where the large lens is, and try to square yourself up. That's perfect. And then So if you keep your eyes closed, what you'll hear, I'm going to take the picture now. So there's going to be 2 flashes. First one's coming now. Then there'll be a second. And then there's a little bit of a jingle, which means you can come out. Perfect. That's great. So we'll say yes to that. It's just scanning you now, so it can analyse you, because what the machine does, it breaks you down. So it looks at pores, it looks at different colours of the skin, looks at wrinkles which you don't have. And then what I need to do is just move these dots to cover the areas that we want it to analyse. And we'll just bring it down here as well. So I'm just lifting up on the forehead, because you said that that was where some of your problem was. So it's running through everything that makes you up. So it looks at your reds, the pores, wrinkles, texture, ultraviolet damage, brown, and also it looks at the porphyrins, which is the bacteria that causes spots. We're really looking at the pores today, but it's all captured for the next time. So here we are. So this is called spots, and what it means is it's anything that's raised or indented on the skin that's bigger than a single pore. And so it picks up some of those potential pores that you actually have across this area. This is the pores, so you can see them, and some of them are larger than others. This shows redness, so this is this little spot. This may be a spot that's going, so these are the things that cause you to have that brown discoloration. And so you don't have any wrinkles. The texture, so you can see where that texture problem is. So in certain lights, your pores will show up a little bit more, and this is what we're going to try to improve for you. And then obviously there's a little bit of ultraviolet there, so anything that's actually in orange shows up sun damage. And the brown is actually where shadows are going to cast. So, you know, you're a young woman, so you don't have those yet. And then this is the bacteria that lives on all of our skin. And this is going to be where you might get the odd blackhead in those particular areas. And normally they represent the pores. So you'll get some blackheads on your pores from time to time. So this is great. We have everything that we actually need. What I do need you to do is just to sign the consent form. We have discussed everything on here. And so if I can just get your signature just here, Kerry. Thank you. That's great. So what we'll do now is we'll take you through to the room where we'll do the treatment, and I'll put your local anaesthetic on. Okay. So this is the Clear and Brilliant, and we just press this button here and the light comes on. And while we're waiting for that to actually warm up, I'll just go through a few things here. We need to wear goggles when we're actually doing the Clear and Brilliant, and we're treating the face. So the patient will wear blackout goggles, and the strap is adjustable, so you can tighten it according to the size of the patient's head, so it's nice and firm but not too tight. And the operator or myself will be using these, and these are going to cover both wavelengths, so it's important that we actually wear those for our own protection. This is the Clear and Brilliant handpiece, and this was the original handpiece. It's actually emitting 1550 nanometers of light. And so this wavelength is looking for water in the skin, and it's penetrating through the epidermis into the dermis. It's going to produce collagen. It's going to help people with tone and texture and refining pores. So this is the original handpiece. Okay, and this one here is the Premier handpiece, which is emitting 1927 nanometers of wavelength. It's looking for water, but it's actually working in a much more superficial plane. So it's in the epidermis. It's creating little wells in the skin, not holes, just little openings where we can actually utilize to get more product into the skin. And so in that way we can actually drench the skin, hydrate it, and do other things that we might need to do. So this is the second handpiece that's introduced. You cannot use both wavelengths together, so you have to change the handpieces. And here is the connection which goes at the back of the device. There's a little round dot on it, which means that that needs to be the uppermost part of the device. So when you plug it in, this needs to be seen. It mustn't reverse the other way. Okay? So this is the Clear and Brilliant, and it has the original handpiece attached. Okay? It's asking me to put a treatment card in. The treatment cards come in a pack like this. You get 12 tips, which are single-use, disposable, and you'll also get a card which will allow you to have 12 treatments. There's the card. And the card slips in to the card reader, like so. Now the machine is validating the card. The tip here is single use, so each patient will have their own tip. When I've finished the treatment, this gets thrown away. It has rollers that will roll over the skin with ease, and this is the only thing that touches the patient. Okay, so this is the thing that I'm actually touching with my glove, so as not to contaminate. And the tip is attached like so, and then you're ready to go. It's asking me now to press the blue button. If I press the blue button, it will start the clock, and the clock is 40 minutes of treatment time, which gives you plenty of time, or 400 centimeters squared. So that's normally the face, maybe the neck and a little bit of the décolletage on a 4 treatment pass. So I've removed most of the local anaesthetic from Kerry's face, but I'm just now going to wash it and make sure that there's no local anaesthetic left on the skin. It's important to dry the skin because both wavelengths of the device are actually looking for water. So if I leave the surface wet, then the energy is going to be there on the surface. Now, taking a white pencil, I'm going to actually mark out the areas because it's important that we actually apply the device in straight lines, and so I don't want to be tempted to go around the curves of the face. So white pencil is better because using a white pencil means I'm not going to impregnate the skin with any colour. So if I use a black, then I might leave some of that residue behind. I'm marking out the areas that I actually want to home in on. So the forehead is going to be treated slightly differently to the eye because the eye is more sensitive. And then I'm going to actually make oblongs or squares because the machine is flat, the face is curved, so I've got to try to keep things in a very straight line. Okay, so now we've marked Kerry up, it's time to put our goggles on. So these are mine, and these are the patient goggles. Now it's time for me to press the blue button. So now it's asking me to select the treatment level. Selecting the treatment level can be done by pressing this button here. So at the moment you'll see 1 blue light, 2 blue lights, 3 blue lights. This will reflect the intensity of the treatment. So when 3 blue lights are showing, it's high, 1 is low, and 2 is medium. So when I've selected my treatment level, then I press the star button, okay? And then the timing will begin. So the handpiece is square and the face or the body is curved. So I need to actually get the patient to be as flat and conforming as possible. So I'm going to ask Kerry to turn her head to the side. And then when I'm actually using the tip, I want to have the handpiece and the rollers in contact with the skin all the time. So it's perpendicular, and I'm going to work backwards. Now my first pass would be here. I'm going to start now. So the start button has been pressed, and my guide light is on the skin. And I'm going to roll it towards me. I'm going to make 2 passes over the same spot. Now the tip will actually change colour, and if it goes red, then I'm going too fast. The whole idea is to lay a certain amount of lesions down on the skin, and if that indication is there, then I'm not doing that. So that's the noise, that's a normal noise, and as I pass down, I'm going over it 100%. So basically I'm doing 2 passes in one direction. And I have to get my passes right next to each other. I don't want any gaps, and I don't want any overlap. How's this feeling, Kerry?
Fine.
And so the protocol for Clear and Brilliant is 4 passes. 2 vertical, 2 horizontal. But we're going to treat some pores today, and so we will do an additional 4 passes over those areas. So that's about the speed at which one should go. So I've done 2 passes, and I'm going to come the other way now. I'm going to start here, and I'm going to roll this way. You'll notice as I roll, I'm moving my hand round the corner, because I have to make sure that the tip is in contact with the skin. And I'm lifting the tip off the skin. If I was to just go back and forth, then at each end I'm going to get more treatment, hot spots, and I could create a trauma to the skin. So that's the 4 passes on the forehead. And when we come to do the areas where she has pores, I will go over this area again for her. Also, what the Clear and Brilliant can do on a temporary basis is plump out the lips. And so Kerry would like me to do that. Before the local anaesthetic wears off, I'm going to do around her lips first of all, so that you can actually see what kind of plumping effect you get. And it is temporary, but it's a nice party treatment, but also it allows the patients to see what their lips could look like if they actually maybe had a lip filler or something of that nature. So I'm going to come across and then down onto the lip, and I'll do half of the lip, so you just get that instant plumping. So you okay for me to do that? So we're going to come here. 2 passes to the bottom lip, 2 passes, and then I'm going to come down from the underneath the nose onto the actual lip itself. We did put some local anaesthetic here. So you can start to see already how it is plumping out. There's an increase in volume on one side rather than the other. So I'll do the other side for her. Okay, so we'll turn Kerry's head again to the side, and this time we'll actually do this section here. So I'm just going to move her goggles slightly, still protecting her. I'm going to come down here and start the same process. Always at a steady speed. Okay, so we're going to go the other way now. If the patient had flaccid skin, then I would stretch it a little bit more to give some support, but Kerry is young, so she's got firm skin. So I'll also treat the earlobe because this is exposed to the sun all the time, and as we get older the earlobe becomes flatter and also elongated, so by putting a little bit of extra collagen in there is always helpful. Okay, so I'm going to ask Kerry to come back to the centre, and you can see how the lips have plumped up, and I'm going to do this section now. Here we go, Kerry. It's important to try to get into all the nooks and crannies around the nose, and so you can cover all the skin surface. And then to do a little bit around the eye, I'm going to pull down the skin and hold my finger near to the lower part of the eye, pulling the skin down, and then with the other finger I'm just keeping the goggles in situ, so I can get to near to the eye as possible but without putting the patient at risk. Now if the patient had a tattoo, facial tattoo, eyebrow around the lips, sometimes they have beauty spots put on, then I wouldn't actually be going over the tattoo with the actual device. Now we're going to just do the nose area. So we're going to come down, again, 100% overlap. And then just down the tip. Okay. So that's 4 passes on that side, and I'm going to repeat it on the other side. Again, I'm going to go in straight lines, 4 passes to one way, to the other. And I've already done the lips on this side, so I won't be repeating that. And then once I've done that, then we'll actually concentrate on the additional 4 areas that we're going to do, 4 passes in this area, across the nose, a little bit up on the forehead, and there's a little bit of congestion that actually happens on the chin. So I'm going to ask Kerry to change onto this side, and we'll start again. Okay, so I'm pressing the star button, and that will actually pause the treatment. The clock is still continuing to go, so it's always good to make sure that your patient has actually been to the bathroom before they start treatment, and so you don't waste any time. I can now safely take off her goggles. So what I'm doing now is just wiping away the white marks on the skin, and then I'm going to just use some hydrating product which will actually help her feel that it's calmer, the skin will be calmer. So this is a Obagi SPF 50 that I'm going to actually put on her today, and this is a product which will give a really good cover, protection, and I'm going to pat it on. And so you can still see the sunblock, and within that time it's going to be able to sink into the skin. Okay, so this redness will last probably until tomorrow, so maximum 24 hours. It looks as if she's had a good workout in the gym, as I said to her before. It does feel warm, but we've put a lot of energy in there, so that's normal. And when you actually do the treatment, the pores that you're trying to refine, because of the inflammation that you're putting in, sometimes they look a little larger. So the patient shouldn't actually worry, because once that inflammation has calmed down, then that's when the pores start to shrink.
So during the treatment, it felt really comfortable. I had the numbing cream on, so that took the edge off of it. It just felt slightly warm in places, mainly the lips and the closer to the eye she was. But apart from that, it was really tolerable. I feel slightly warm and a little bit like I've just been in the sun for too long. So the consultation really helped me during the treatment because I knew what would be happening, and she went over that as we were having the treatment as well, so I obviously could remember, and I wasn't surprised by anything that was happening. So my practitioner was very methodical in how she treated my face, so I wasn't surprised by the treatment because it's a bit off-putting when you can't see, and I felt like she wasn't jumping all around my face. It was very ordered, so I could kind of see what was coming next, and it wasn't a surprise to me. So at the moment I'll be going through the recovery phase, which can take up to 7 days, at which point I'll then see my practitioner, and they'll check my progress and we'll decide where to go from there.
So what Clear and Brilliant offers is 2 potential wavelengths that you can actually offer your patient. The first is 1927, which is working superficial in the skin. It creates little wells where you can actually utilize to fill up the skin with good products. So you can actually get better permeability of those products, and the patient's skin will be healthier as a result of that. The second wavelength, which we used today, was 1440, and this is going deeper into the living part of the skin, the dermis. It's going to stimulate collagen because of the heat that we create, and as a result of that, you're going to get a skin that looks brighter, fresher, and also those pores are going to be refined. It is the gold standard for pore refining in the industry, and really a very, very simple device to actually use. Patients would typically use several products following treatment, and so this will aid with recovery, but also get them into a good regime. And so hydration is always important. There are several hydrating products on the market. Today I use the Obagi Hydrate. We would also use vitamin C on certain skin types that aren't oily. This also helps to take down the redness following treatment. And of course, today we use an SPF 50, which was from Obagi. This is a zinc product which actually will help to reflect the sun and give the patient total protection.